So this is a taping technique for a lateral ankle sprain, and we're using 2-inch zinc oxide tape. So our first strips are going to be our proximal anchors using zinc oxide tape, and these are travelling down at a slightly oblique angle. So we're following the contours of the lower leg, and we're doing 2 anchors overlapping by a half. Our next one, our distal anchor point, will be around the midfoot. Again, free from any tension at all. This is just going to be a strip of tape which attaches other bits of tape too. Okay, so for a lateral ankle sprain, then our stirrups are going to be travelling medial to lateral. If it was for a medial ankle ligament sprain, then they'd be travelling lateral to medial. So these are going to attach onto our proximal anchor on the medial side. It's really important these aren't positioned and directed too far anteriorly. They should be travelling under the calcaneus, free from tension so far. Make sure it's really firmly stuck down and applied onto our anchor. Then when we cross under the calcaneus, we're going to add as much tension as we feel the patient needs. That's going to support the rear foot and minimise inversion. So there's our first stirrup. We're going to incorporate 3 stirrups, and it's important that we provide support through different ranges of inversion. So we need to spread these out with similar to a fan formation. Our next strip will be starting and more anteriorly through here, but it's still going to follow under the calcaneus. So firmly stick it down, go under the calcaneus, add as much tension as you feel you need to support the lateral ankle ligaments, and then position this and stick this down anteriorly. Final stirrup is going to be positioned more posteriorly. So we'll start it just here. Again, going under the calcaneus, adding tension and attaching onto the lateral side of this proximal anchor. Our next strip of tape is going to be a horseshoe, and this just closes some of the stirrups off. It makes them really firmly applied on towards the skin, and it also offers a bit more support for the subtalar joint. So we start on the medial side of our distal anchor point, attaching down here, adding an appropriate level of tension, going around the back of the calcaneus, and then sticking down onto the lateral side on towards here. So our next bits of tape are going to be our heel locks, which are really, really important. And we start these on the tibia, and they're angled inferiorly and laterally. So we bring it down back towards us, then we go underneath, it re-emerges on the medial side, then we pull it round again under the calcaneus, add as much tension as you need to. So you can see when I add more tension here, I'm really pulling that rear foot into an everted position, which will minimise inversion. We bring it over and up, try and avoid any creasing in the tape. And there's our first heel lock. Second one is going to start a bit lower down, angle it inferiorly and laterally, pull it round, underneath, same direction as our first heel lock, add an appropriate level of tension, and we're going to bring that over the top here. If you want to put a bit of tape over any exposed area of the skin, that will hopefully reduce any impact or any excessive friction that might happen from laces or clothing or even shoes. So to close this all off, then proximally, using our zinc oxide tape, this will close over all the heel locks and also the stirrups. And if you need to, you can also close over the midfoot. Here, again, free from any tension at all. And that finishes the lateral ankle taping technique.